Nutrition-focused physical assessment. Hello. Nice to meet you today. My name is Kristen. Your doctor and healthcare team ordered me to come in for a nutrition assessment. Is this a good time to come in? Sure. Great. As I get started, we'll get going and I'm going to tell you exactly what I'm doing and what I'm looking for. Now, can you explain to me what your diet's been like in the past couple of months?
Basically, I try to be low carb because it's summer. I guess it's been more fruits as snacks and things rather than things that are bad for me. But all in all, it's been pretty good.
Okay. Now, when you wake up, what do you eat for breakfast?
I don't always eat breakfast, but usually it's either eggs or fruit.
Do you have any snacks, and what do you have for lunch?
I don't usually eat snacks in the morning, but for lunch it's usually salad and chicken, or just a salad, or occasionally a sandwich, but not often.
And what do you have for dinner?
Dinner's always a salad with some kind of a protein. I don't eat a lot of fish, but a vegetable, or not a lot of starches either.
Do you have any dessert?
Yeah, I usually do have dessert, either ice cream, or lately it's been blueberries with whipped cream, or some kind of fruit.
Have you noticed any changes recently or in the past couple of months with your diet?
No, I think because it's summer, it's been more fresher vegetables, more fresh fruits.
All right, great. Now let me wash my hands. I'm going to put on some gloves and we'll get ready for the assessment.
Okay.
If you have any questions about the assessment, please let me know. Mainly, this assessment is looking for macronutrient and micronutrient deficiencies, any signs of malnutrition or fat depletion, and a lot of the time, nutritional deficiencies such as protein deficiencies may go unnoticed. And we look for these areas that are often overlooked. I'm going to start to what we call a head-to-toe evaluation and assessment. And I'm going to start from the top of your head to the tip of your toes. Let's start with your head and your hair. Okay. So the first thing I'm looking for with your hair is that your hair is nice and healthy. It's shiny, doesn't look like any strands are coming out when I'm touching or pulling on your hair. Do you notice any your hair coming out more so than?
No, not a lot.
Okay, good. I also want to make sure your hair is not thin, and I don't want to find any color changes or pigmentation. All right, so moving on down, we're going to take a look at your eyes. So I want to see that your eyes don't have any redness, yellow, swelling, and I want to make sure that your fat pads are nice and healthy on your face, under your eyes. So let's take a look. Good, excellent. Take a look at my finger. Eyes look good. And I want to take a look at your temple. Turn your head to the side for me. Good. Your temples look nice and healthy. No signs of muscle wasting. Now I'm going to take a look at your lips. I want to make sure your lips don't look dry. They look nice and healthy. And there's no signs of fissures or sores. Nope. Your lips look great. Now I'm going to take a look at your teeth. So turn. Looks good. Looks like one tooth.
Yeah, I'm getting an implant.
Good, it looks good. I want to see healthy gums, no brown spots. Are you a smoker?
No.
Good. And I'm going to take a look at your face color. I want to make sure you look healthy and don't look pale. Excellent. Now, stick out your tongue. I want to see if, what your tongue looks like. Good. Your tongue looks healthy. I don't want to see any bright inflamed colors. I don't want to see any glossitis and any swelling or inflammation. Is your taste still the same? Are you experiencing any taste changes? Does food taste differently to you? Nope. Great. Now I'm going to take a look at your neck. Is it okay if I put some pressure on your neck and to the sides to check out your glands? Sure. Does anything feel swollen or inflamed? Excellent. Now moving on down, we're going to take a look at your shoulders. I want to make sure that they're rounded, smooth, not square. So I'm going to ask you to drop that arm. Excellent. Your shoulders look great. Moving on down, I'd like you to actually stand up for me. Now, I'd like you to put out your arm. Good. I'm just gonna check for any signs of muscle wasting. Good, I'd like you to press into my hand. I'm just gonna check into your shoulder blade. Excellent. Take a seat. Now put out your hand. I'm just gonna go down, making sure there's no swelling at the joints. I'm just gonna kind of put your finger, make sure you're hydrated. Now I'd like you to take both fingers and squeeze them together like the OK sign. Good, I just wanna make sure there's no muscle wasting or problems with your muscles, any twitches. Good, I'm gonna take a look at your nails. They look like they're nice and healthy. I don't wanna see any brittle fingers. And I wanna see that your capillary refills. Good, checking out your hydration. Do you have any wounds that haven't healed or take slow to heal? Good. And would you mind staying for a minute, Ben? We're gonna take a look at your spine.
Okay.
Wonderful. Hips look good. No signs of muscle wasting. Take a seat. Thank you. Now I'm gonna move down and take a look at your quads and your kneecaps. So let's take a look. Is there any signs of swelling? No. Good. Does your knee feel inflamed? Good. I'm gonna check for muscle wasting in your calf. Making sure there's no cramps. Are you experiencing any cramps recently?
No.
Good. And we're gonna check for edema. Good. Good. Excellent. Looks like there's no edema in your ankles or feet. Do you have any questions for me? I don't think so. All right, great. Now throughout this whole screen, it looked like your skin really bounced back. I would recommend continuing to drink a lot of water. There's no signs of edema. And I'm going to talk to your doctor and healthcare team and let them know what I saw on the assessment today. It looks like everything looks pretty great. It doesn't look like there's too many things we need to keep an eye on. Before I discharge you, I would like to set up a consultation to go over some good meals to eat for breakfast and for lunch, and maybe some good snack options. Thank you so much. It was great meeting you today, and I hope you have a great day.
Thank you. Nice to meet you.